Schizophrenia is a complex and often misunderstood mental disorder that affects how a person thinks, feels, and behaves. It's a chronic and severe condition that can lead to a range of symptoms, including hallucinations, delusions, disorganized thinking, and impaired daily functioning. This comprehensive essay will delve into the various aspects of schizophrenia, including its history, symptoms, causes, diagnosis, treatment, and impact on individuals and society. 1. History of schizophrenia. 1.1 Early descriptions. The history of schizophrenia dates back to ancient times. Early descriptions of symptoms resembling schizophrenia can be found in ancient texts, such as the Egyptian Ebers Papyrus, circa 1550 BCE, and the writings of Hippocrates, who described mental disorders involving paranoia and hallucinations. However, it wasn't until the late 19th and early 20th centuries that schizophrenia began to be recognized as a distinct mental illness. 1.2 Émile Kraepelin and dementia praecox. The modern conceptualization of schizophrenia began with the work of Émile Kraepelin, a German psychiatrist. In the late 19th century, Kraepelin categorized various mental disorders and distinguished schizophrenia from other forms of psychosis. He coined the term dementia praecox, referring to a condition characterized by early onset and progressive cognitive decline. 1.3 Eugen Bleuler and schizophrenia. In 1911, Swiss psychiatrist Eugen Bleuler introduced the term schizophrenia, derived from the Greek words schizo, split, and phren, mind. Bleuler emphasized that schizophrenia involved a splitting of mental functions rather than a single disorder. He identified four fundamental symptoms, known as the 4 A's: affective flattening, alogia, poverty of speech, anhedonia, inability to experience pleasure, and avolition, lack of motivation. 2. Symptoms of schizophrenia. Schizophrenia is characterized by a range of symptoms, which can be broadly categorized into positive, negative, and cognitive symptoms. 2.1 Positive symptoms. Positive symptoms are those that involve an excess or distortion of normal functions. They include hallucinations. Hallucinations are false sensory perceptions that occur without external stimuli. Auditory hallucinations, such as hearing voices, are the most common type in schizophrenia. Delusions. Delusions are false beliefs that are firmly held despite contradictory evidence. Common delusions in schizophrenia include paranoid delusions, believing others are plotting against them, and grandiose delusions, believing they have extraordinary abilities or powers. Disorganized thinking. Disorganized thinking is reflected in speech patterns that are incoherent or illogical. This can manifest as tangential speech, loose associations, or word salad. Grossly disorganized or catatonic behavior. This includes unpredictable agitation, inappropriate emotional responses, and catatonia, a state of immobility and unresponsiveness. 2.2 Negative symptoms. Negative symptoms represent a reduction or absence of normal functions. They include affective flattening, a reduced range of emotional expression, often appearing as a lack of facial expressions or gestures. Alogia, a decrease in the production of speech, resulting in brief and unelaborated responses. Anhedonia, an inability to experience pleasure from activities that were previously enjoyable. Avolition, a lack of motivation to initiate and sustain purposeful activities, leading to neglect of personal hygiene and social withdrawal. 2.3 Cognitive symptoms. Cognitive symptoms affect memory, attention, and executive functioning. They include impaired working memory, difficulty holding and manipulating information over short periods. Poor attention, difficulty maintaining focus and concentration. Impaired executive functioning, difficulty with planning, organizing, and problem solving. 3. Causes of schizophrenia. The exact cause of schizophrenia remains unknown, but it is believed to result from a combination of genetic, environmental, and neurobiological factors. 3.1 Genetic factors. Genetic factors play a significant role in the development of schizophrenia. Studies have shown that individuals with a family history of schizophrenia are at a higher risk of developing the disorder. Twin studies indicate that if one identical twin has schizophrenia, the other twin has a 40 to 50% chance of developing it. Several genes have been implicated in schizophrenia, but no single gene is responsible for the disorder. 3.2 Environmental factors. Environmental factors that may contribute to the development of schizophrenia include prenatal exposure. Exposure to infections, malnutrition, or stress during pregnancy has been linked to an increased risk of schizophrenia. Birth complications. Complications during birth, such as hypoxia, lack of oxygen, can increase the risk of developing schizophrenia later in life. Childhood trauma. Experiencing trauma, abuse, or neglect during childhood is associated with an increased risk of schizophrenia. 3.3 Neurobiological factors. Neurobiological factors involve abnormalities in brain structure and function. These include dopamine hypothesis. The dopamine hypothesis suggests that an overactivity of dopamine neurotransmission in certain brain regions contributes to the positive symptoms of schizophrenia. Antipsychotic medications that block dopamine receptors can reduce these symptoms. Brain structure abnormalities. Neuroimaging studies have identified structural abnormalities in the brains of individuals with schizophrenia, such as enlarged ventricles, reduced gray matter volume, and abnormalities in the hippocampus and prefrontal cortex. Neurodevelopmental model. This model suggests that schizophrenia results from abnormal brain development during prenatal or early postnatal life. Factors such as genetic mutations, infections, or environmental stressors can disrupt normal brain development and increase the risk of schizophrenia. 4. Diagnosis of schizophrenia. 4.1 Diagnostic criteria. Schizophrenia is diagnosed based on the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, and the International Classification of Diseases, ICD-10. The DSM-5 criteria for schizophrenia include: Criterion A, 2 or more of the following symptoms must be present for a significant portion of time during a 1-month period: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. Criterion B, significant impairment in one or more major areas of functioning, such as work, interpersonal relations, or self-care. Criterion C, continuous signs of the disturbance persist for at least 6 months, with at least 1 month of active symptoms. Criterion A. Criterion D, schizoaffective disorder and mood disorder with psychotic features have been ruled out. Criterion E, the disturbance is not attributable to the physiological effects of a substance or another medical condition. 4.2 Differential diagnosis. Schizophrenia can be difficult to diagnose because its symptoms overlap with those of other mental disorders. Differential diagnosis involves distinguishing schizophrenia from conditions such as bipolar disorder. Bipolar disorder can involve psychotic symptoms during manic or depressive episodes. However, in bipolar disorder, these symptoms are episodic and occur within the context of mood disturbances. Schizoaffective disorder. Schizoaffective disorder involves symptoms of both schizophrenia and mood disorders, depression or bipolar disorder. The psychotic symptoms in schizoaffective disorder occur independently of mood episodes. Major depressive disorder with psychotic features. Severe depression can be accompanied by psychotic symptoms, but these are typically mood congruent, related to depressive themes. Substance-induced psychotic disorder. Substance abuse or withdrawal can cause psychotic symptoms. A thorough assessment of substance use history is necessary to rule out this possibility. 5. Treatment of schizophrenia. Schizophrenia treatment typically involves a combination of pharmacological and psychosocial interventions. 5.1 Pharmacological treatment. Antipsychotic medications are the primary pharmacological treatment for schizophrenia. They are classified into 2 categories: typical, first-generation, antipsychotics and atypical, second-generation, antipsychotics. Typical antipsychotics, these include medications such as chlorpromazine, haloperidol, and flufenazine. They primarily target dopamine receptors and are effective in reducing positive symptoms. However, they can cause significant side effects, including extrapyramidal symptoms, EPS, such as tremors, rigidity, and tardive dyskinesia, involuntary movements. Atypical antipsychotics, these include medications such as risperidone, olanzapine, quetiapine, and aripiprazole. Atypical antipsychotics target both dopamine and serotonin receptors and are associated with a lower risk of EPS. They are effective in treating both positive and negative symptoms, although they can cause metabolic side effects such as weight gain and diabetes. 5.2 Psychosocial interventions. Psychosocial interventions are essential components of schizophrenia treatment and include cognitive behavioral therapy, CBT. CBT helps individuals with schizophrenia identify and challenge distorted thoughts and beliefs, develop coping strategies, and improve functioning. Family therapy. Family therapy involves educating family members about schizophrenia, improving communication, and reducing stress within the family. Social skills training. This intervention focuses on enhancing social and interpersonal skills, such as communication, problem solving, and assertiveness. Supported employment. Supported employment programs assist individuals with schizophrenia in finding and maintaining competitive employment, providing job coaching and support. Assertive community treatment. ACT is an intensive, team-based approach that provides comprehensive, individualized support and treatment to individuals with severe schizophrenia in the community. 6. Impact of schizophrenia. 6.1 Individual impact. Schizophrenia has a profound impact on the lives of individuals affected by the disorder. It can lead to functional impairment. Schizophrenia can impair an individual's ability to work, attend school, and engage in daily activities. This can result in social isolation, unemployment, and homelessness. Comorbid conditions. Individuals with schizophrenia often have comorbid conditions such as depression, anxiety, substance use disorders, and physical health problems. These comorbidities can complicate treatment and worsen outcomes. Stigma and discrimination. Stigma and discrimination against individuals with schizophrenia are pervasive and can lead to social exclusion, reduced opportunities, and reluctance to seek help. 6.2 Societal impact. Schizophrenia also has a significant impact on society, including economic burden. The economic burden of schizophrenia includes direct costs, e.g., healthcare expenses, hospitalization, and indirect costs, e.g., lost productivity, disability payments. Schizophrenia is one of the most costly mental disorders. Healthcare system. Schizophrenia places a substantial demand on healthcare systems, requiring a range of services, including acute inpatient care, outpatient services, community mental health support, and long-term care. Public health. Schizophrenia is a major public health concern due to its prevalence, chronicity, and impact on individuals' quality of life. Addressing the needs of individuals with schizophrenia is essential for improving public health outcomes. 7. Advances in schizophrenia research. Research on schizophrenia is ongoing, with advancements in understanding its etiology, treatment, and prevention. 7.1 Genetic research. Advances in genetic research have identified several risk genes associated with schizophrenia. Genome-wide association studies, GWAS, have highlighted the polygenic nature of the disorder, with many genes contributing small effects. Research into gene-environment interactions is also providing insights into how genetic and environmental factors interact to increase the risk of schizophrenia. 7.2 Neuroimaging. Neuroimaging studies have advanced our understanding of the structural and functional abnormalities in the brains of individuals with schizophrenia. Techniques such as magnetic resonance imaging, MRI, and positron emission tomography, PET, are used to study brain connectivity, neurotransmitter systems, and the effects of treatment on brain function. 7.3 Novel treatments. Research into novel treatments for schizophrenia includes glutamatergic agents. Targeting the glutamatergic system is a promising avenue for developing new antipsychotic medications. Drugs that modulate glutamate receptors may help reduce symptoms and improve cognitive function. Anti-inflammatory treatments. Inflammation has been implicated in the pathophysiology of schizophrenia. Anti-inflammatory treatments, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and cytokine inhibitors, are being investigated for their potential to reduce symptoms. Psychosocial interventions. Advances in psychosocial interventions include the development of digital health technologies, such as mobile apps and online platforms, to deliver therapy and support. Virtual reality (VR) is also being explored as a tool for social skills training and cognitive rehabilitation. 8. Living with schizophrenia. 8.1 Personal stories. Personal stories of individuals living with schizophrenia highlight the challenges and triumphs of managing the disorder. These narratives can provide hope and inspiration to others facing similar struggles and help reduce stigma. 8.2 Coping Strategies. Effective coping strategies for individuals with schizophrenia include medication adherence. Adhering to prescribed medication regimens is crucial for managing symptoms and preventing relapse. Routine and structure. Establishing a daily routine and structure can help individuals manage symptoms and reduce stress. Support systems. Building a strong support system, including family, friends, and mental health professionals, is essential for emotional and practical support. Self-care. Engaging in self-care activities, such as exercise, healthy eating, and mindfulness practices, can improve overall well-being. 8.3 Advocacy and support groups. Advocacy and support groups play a vital role in supporting individuals with schizophrenia and their families. Organizations such as the National Alliance on Mental Illness, NAMI, and the Schizophrenia and Related Disorders Alliance of America, SARTA, provide resources, education, and advocacy to improve the lives of those affected by schizophrenia. 9. The future of schizophrenia treatment. 9.1 Precision medicine. Precision medicine aims to tailor treatment to the individual characteristics of each patient. Advances in genetics, neuroimaging, and biomarkers hold the potential to develop personalized treatment plans that optimize outcomes and reduce side effects. 9.2 Early intervention. Early intervention in schizophrenia is crucial for improving long-term outcomes. Identifying and treating individuals at high risk of developing schizophrenia during the prodromal phase, early signs and symptoms, can prevent or delay the onset of the disorder. Early intervention programs, such as specialized clinics and coordinated care models, focus on providing comprehensive support to young people experiencing early symptoms. 9.3 Public health initiatives. Public health initiatives aim to reduce the burden of schizophrenia through prevention, education, and policy changes. These initiatives include awareness campaigns. Public awareness campaigns can reduce stigma, increase understanding of schizophrenia, and encourage individuals to seek help. Mental health screening. Implementing mental health screening in schools, workplaces, and primary care settings can identify individuals at risk and facilitate early intervention. Policy advocacy. Advocating for policies that improve access to mental health care, protect the rights of individuals with schizophrenia, and promote research funding is essential for addressing the needs of this population. 10. Conclusion. Schizophrenia is a multifaceted disorder that poses significant challenges to individuals, families, and society. Despite its complexity, advancements in research, treatment, and advocacy offer hope for better understanding, managing, and ultimately preventing schizophrenia. Continued efforts to reduce stigma, improve access to care, and support individuals living with schizophrenia are essential for fostering a more inclusive and compassionate society. By embracing a comprehensive approach that integrates biological, psychological, and social perspectives, we can move towards a future where individuals with schizophrenia can lead fulfilling and meaningful lives. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.